Welcome to Medicine Handy Point. Today we will discuss a topic which is taking history from a patient presenting with Wheeze. So let's start that. So it's a very important topic in the OPD and clinic setting. So we start about the Wheeze by asking the patient the onset of the disease. So because based on the onset, we can divide it into acute, subacute, and chronic. Acute wheeze could be anaphylaxis, acute exacerbation of asthma or COPD. It could be aspiration, or it could be foreign body aspiration. This aspiration could be any like unconscious patient or with low GCS patient aspirating food or vomits, which can lead to then wheeze. Subacute wheeze can occur in the patient with respiratory tract infection, and even it could be because of left ventricular failure, or it could be pulmonary embolism. Chronic wheeze can be caused by asthma and COPD. Acute wheeze can also be caused by asthma and COPD. That's why usually wheeze is associated with asthma and COPD. Malignancy can also causes chronic wheeze. Then we will ask respiratory condition which can cause wheeze. So if the patient is having cough along with wheeze and it is a chronic non-productive cough, is likely asthma. We will ask about shortness of breath with the wheeze. We'll establish how much the patient can walk. We'll ask about chest tightness. If the patient is having chest tightness with the wheeze, it could be asthma or COPD. We'll ask about hemoptysis. Wheeze with hemoptysis could be malignancy or pulmonary embolism. Then we'll ask about change in voice quality. Which could be lung malignancy, involving recurrent laryngeal nerve or laryngeal disease, or GERD can also causes wheeze and change in voice quality. We'll ask about constitutional symptoms like fever, night sweat, and weight loss, which will suggest any malignancy underlying going on. Then cardiac condition which can cause wheeze is left ventricular heart failure. So in that case, the patient will be having chest pain, dyspnea, orthopnea, PND, ankle edema. Other condition which can cause wheeze are anaphylaxis. In that case, there will be urticaria, tongue swelling, angioedema. For Church-Strauss syndrome, we will ask about rhinitis with asthma, palpable rash of mononeuritis multiplex. Flushing of the face with wheeze and diarrhea will suggest carcinoid syndrome, rare cause of wheeze. GERD can also cause wheezing as well. So we'll ask about these conditions. Then we will ask what are making the wheeze worse. So for that we will ask is smoking, exercising cold, house dust mites, animal denders, emotional stress, dust and fumes, and pollens. Dust mites are small mites which are present in house dust. Animal dander is basically the dead tissue from the skin, peelings from the skin of the animals or hair. So these are the animal dander. Then we will ask about the past history, which will include respiratory conditions, asthma and COPD. We will ask about any atopy history. Atopy is a combination of eczema, allergic rhinitis, and eczema, allergic rhinitis, and asthma. These three conditions occur in atopy: eczema, asthma, and allergic rhinitis. We will ask about GERD history. Previous endotracheal intubation can sometimes cause post-intubation tracheal stenosis present as a wheeze and stridor. Family history, we will ask about atopy, asthma or cardiac conditions which can run in the family. Social history should include occupation, because some patient will be having occupational asthma, and they will be having wheeze when exposed to any kind of allergen in their working environment. So occupation is very important. Smoking can history is important because it can cause COPD, and it can also exacerbate the wheezing of the asthma. Animal and birds at home is very important because the patient may be having allergy to those kind of animals. I hope you like the video, and please subscribe to the channel.